Today we're going to uncover hip mobility, and I'm going to teach you exactly what you need to stay running with confidence and comfort. Hip mobility is just a fancy term of saying how much does this ball and socket joint, how much does the ball move freely in the socket in the multiple motions that the hip moves. In this video, I actually want to break down how much motion you need for each of those motions of flexion, extension, adduction, abduction, internal, external rotation to be a competent and confident and comfortable runner. And if we haven't met, I'm Dr. Sarah the Hip Doc. I'm a physical therapist and run coach, and I have helped hundreds of women and men as well with hip pain get back to running with confidence and comfort. It has been a joy to do so, and I want to spread this knowledge, so I spread hope everywhere. Let's go ahead and start with hip flexion. So that's bringing our leg upwards like this. Functionally, we need about 110 to 120 degrees. For running, all we need is about 60 to 70 degrees. That's going to allow us to pick our leg up and clear obstacles and bring our leg into our next stance. Up next is hip extension. Functionally, we need about 10 to 20 degrees of hip extension. For runners, we need about 10 to 15. So this is going to help us trail that leg behind us and get that nice push off to boom, go into our next step. Hip ab and adduction are also super important for runners. Abduction is when I'm bringing my leg away from the body, and adduction is when I'm bringing it in. Normally, we need about 40 to 50 degrees here, and then adduction, we need about 20 to 30. For running, we only need about 10 to 20 degrees for each respective thing. Now, you might be like, Sarah, I'm not running like this. And you're like, yeah, you're not running like that. However, ab and adduction are very important when I'm on a single leg stance in running, and it's more of my body moving on my pelvis. So when I'm on my single leg stance, my pelvis is dropping my leg into a relative adduction because it's coming closer to my body. But if I'm able to maintain a nice and neutral pelvis, then I'm getting a little bit more into abduction. Our pelvis kind of goes like this, up and down into that side bending motion as we're translating forward with running. So we need a little bit of that motion to do our thing as runners. Similar to ab and adduction, internal and external rotation is crucial for our pelvis and hips when we're running. Internal rotation is when I'm bringing my hip inwards, and then external rotation is when I'm bringing my hip outwards. But you might be like, Sarah, I'm not doing this when I'm running. And I'm like, yeah, I know, but you do need that body on pelvis rotation. So as I'm pushing off and rotating forwards, I'm rotating inwards on this hip. And then as I'm coming and completing my next step, I need relative external rotation to right myself and make sure that I'm not running off into different directions. You need about 30 to 40 degrees of internal rotation functionally and 40 to 50 of external rotation functionally. But for running, you only need like 10 to 15%. Those numbers might have been a little bit of a snooze fest for you, but my biggest point is that you don't need a lot of range of motion to be running. We want to look for symmetry from side to side and that we're really meeting those norms. So you don't need to be doing those crazy exercises where people are like bringing their leg all up and around and stretching and doing all these crazy things. We just need a little bit of hip mobility to make sure that we're able to run well. Linked below is actually my free hip mobility guide. So you'll see some of my favorite exercises that I like to do for myself and my clients to make sure that they're getting the mobility that they need to be able to run comfortably. These are 3 instances I like to use hip mobility work. Number 1 is delayed onset muscle soreness. Imagine if my bicep is super sore. Like I just lifted a ton and it's really sore. If I did a really heavy bicep curl, it's still going to be very sore. But what if I just did body weight bicep curls and I just brought that motion through its full range of motion? What that's going to do is it's going to vascularize my bicep muscle, and it's also going to lubricate the joints in and around my bicep to make sure that that sucker starts to feel a little bit better. Number 2 is pain with certain motions. What if I'm someone that as I'm dropping into my squat, I'm getting a lot of pain into the anterior aspect of my hip? Well, what if I go into a hands and knees position and then I start rocking back and forth on my hands and knees? I'm still going to get that same bending and flexing of my pelvis, but there's going to be less compression going up into my hip, which might allow me to do it more comfortably, get more joint lubrication, get more muscle vascularity, and feel really good in the process. Okay, lastly, this one might be shocking to some of you. I'm not regularly giving mobility work to a lot of my clients. I know. And this is why. They're busy. They're busy moms, young professionals. They don't have time to do a full strength training routine, a full running routine, and a full mobility routine. If I can find an exercise that they can do comfortably, like a assisted squat or a full lunge that is going to work on their mobility deficit in their hip, as well as strengthen the muscles around it, I am going to give that to them instead of having all three of those programs set in stone for them. If someone has the time and the capacity to get their full run training in, their full strength training in, and mobility, yes, of course, I'll give them those things. But in general, I'm trying to find a way to use strength training to also give them mobility so I can condense and collapse their time. If you're interested in checking out my free strength guide, that's also available in the show notes. But let me know what you thought of this video in the comments, and I look forward to chatting with you soon.